Okay, folks, so just real quick here, as quick as I can, I want to share this information here from a recent Senate bill that was pushed through here in Nevada concerning gender dysphoria and gender incongruence and insurance companies. And I find it very curious, because as you read through it, you can clearly see that it has a global influence in there. And I'm pretty sure that it's the same standard and the same global guidance that has been put forth in many other cities and towns and states across this country here. And certain states are choosing to adopt it and move forward with it, and others are choosing to completely and totally reject it. Well, Nevada, it appears, has decided to go ahead and adopt it and move forward with it. In fact, including requiring health insurance to cover the treatment for it, and for it to be covered on Medicaid. Yeah, you heard that right. Taxpayers to pay for this kind of treatment for people. Okay? It's just, when it comes to a person's personal right to choose, I don't have a problem with it. I'm all for people's rights and freedoms to choose. Okay? Bottom line. If you stand for people's rights for freedoms, then you stand across the board for it no matter what they choose. Okay? The same thing for parents as far as parental rights go. If you stand for parental rights and parents having the right to choose what they want for their children, then you need to stand across the board for it, even if it just spins your moral compass in a hurly-whirly mess. You still have to stand for it. Otherwise, you're a hypocrite. And that's the bottom line. That's the harsh reality of a lot of these things that are being pitched through this global influence. It's meant to divide and conquer. It's meant to be so absurd to some people, and then to other people meant to, make sense in their mind, okay? And it's all a divide and conquer, folks. But when it comes to this stuff being covered by the public taxpayers, I have a problem with that. It should not be covered. It's ultimately a lifestyle decision. And I'm not going to say too much about it when it comes to that, because I actually have a family member that is making the decision. They're an adult, and they've made the decision to transition in their lifestyle and make decisions for themselves. It doesn't have a direct effect on me necessarily. All I can do is just respect their decision and their right to choose. And I have the same respect for parents who choose whatever they want for their children, too. It might not sit well with my own personal beliefs, my own personal opinion, but the bottom line is, I don't have any right to tell a parent what they can and cannot choose for their child either, period. And that's the harsh reality of it and all. And I know I'm probably going to lose a few of y'all by making that statement, but that's the bottom line. And if you think anything other, then you're a hypocrite, period. But as far as Nevada here adopting this stuff, I just wanted to point out here the global influence and how it's published in this bill. It's even underlined in this bill, the influence, where this is coming from, okay? And again, it's meant to divide and conquer. There's a global influence going on that the full intention is to divide and conquer from the inside out, okay? And whether some of these actors up there, like these senators, Senator Scheibel, D. Harris, and Spearman, whether they realize it or not, or this joint sponsor, Assemblywoman Gonzalez, whether they want to believe it or accept it or know it, they're playing the part of the divider. They're introducing this stuff knowing full well that there is going to be a huge division in the residents and in their constituents here and the people that live here in the state of Nevada. They know that it is, but they're still pushing it forward. And they're very smug about it. These actors here, I'll tell you what, they're very good at acting very smug and very triggering, I must say. But in this particular bill here, Senate Bill 163, it requires certain public and private policies of health insurance and health care plans, including Medicaid, to cover the treatment of conditions relating to gender dysphoria and gender incongruence. Oh, what do you know? It's raining outside. How about that? Authorize these policies and plans to prescribe requirements that must be satisfied before the insurer will cover surgical treatment for conditions relating to gender dysphoria or gender incongruence for persons who are less than 18 years of age. And again, you're getting into a subject where it is ultimately the parent's right to choose. And if they choose something, like I said, because I'm repetitive, I gotta say it again, if they choose something that just sends your moral compass spinning and hurling and whirling, there's really not too much you can do about it. Because if you want to interfere and make the decision on what certain parents have a right to choose for their children, but not everyone, you're a hypocrite. And 3, it requires an insurer to consult with a provider of healthcare with experience in prescribing or delivering gender-affirming treatment when considering certain appeals of a denial of coverage. And now again, gender-affirming treatment. The fact that we have validated and affirmed this as a profession, it just another example of the foothold that these globalists and these global propagandists have in our country, you know? And it's just, having the taxpayers pay for it, I have a problem with it. Like I said, I fully respect anyone's decision as an adult and what they want to do, and I fully respect a parent's decision and whatever they decide for their children. Doesn't matter, I don't care. It's your right to choose, whatever. Just respect my rights to choose as well. And taxpayers should not be paying for it, though. It should not be publicly funded, period. And it talks about all of these different terms and stuff. And it's interesting that such coverage must include coverage of medically necessary psychosocial and surgical intervention and any other medically necessary treatment for such disorders provided by endocrinologists, pediatric endocrinologists, social workers, psychiatrists, psychologists, gynecologists, speech-language pathologists. Really? Primary care physicians, advanced practice registered nurses, physician assistants, and any other providers of medically necessary services for the treatment of gender dysphoria or gender incongruence. This section does not require a policy of health insurance to include coverage for cosmetic surgery performed by a plastic surgeon or reconstructive surgeon that is not medically necessary. And then they go into some of these terms of what's medically necessary and the treatment recommendations and everything. And it requires, right here it says, it requires a written plan for treatment that covers at least 1 year must be developed and approved by at least 2 providers of health care. Just 1 year? I mean, I'm just saying it's a lifelong lifestyle change, right? It's a lifelong, long-term change. And you just want a written plan just for 1 year, though, is required in order to have your insurance pay for it, right? Parental consent is provided for the insured unless the insured is expressly authorized by law to consent on his or her own behalf. And here's where the global influence comes in, okay? And this term and this statement is made throughout every section, okay? And number 5, when determining whether treatment is medically necessary for the purposes of this section, an insurer must consider the most recent standards of care published by none other than the World Professional Association for Transgender Health or its successor organization. There is your global influence. There's your guidebook right there. That standards of care published by the World Professional Association for Transgender Health, I'm willing to bet, was printed up and sent out to multiple Department of Health agencies across our country. And there, like I said, there were some that rejected it, but there are some, like here in Nevada, that decided to embrace it and use it as a tool to exploit the population and the residents here and get us divided and get us debating over whether or not parents have a right to choose what's best for their children. And again, some people are arguing from their moral grounds and from their moral soapboxes. And some people have very good arguments and very opinions about it. It's so wide. Like the division that this particular topic and this particular bill being introduced here in Nevada, and I have to believe that these women that introduced this, or whatever they are, I'm not sure if they're all women or not, but these people that introduced this bill and have pushed it forward, I have got to believe that they have got to know that applying these standards of care from this global influence is causing division, and they know it, and they know it. And they know damn well they should not be asking taxpayers to pay for people to make these decisions with their lives. Okay? But again, I just wanted to point out, it's mentioned in every section. The standards of care should be considered. I even underlined it. This is kind of interesting here where it talks about gender dysphoria. That means distress or impairment in social, occupational, or other areas of functioning caused by a marked difference between the gender identity or expression of a person and the sex assigned to the person at birth, which lasts at least 6 months and is shown by at least 2 of the following. And then it gives all these definitions. It's very interesting when they create these global guidances, because they also offer up recommendations and wording, and they even offer them up speeches, okay, in their guidebooks. It's just, it should not be considered for taxpayers to pay. It really should not be integrated into our healthcare system and become part of our Department of Health and Human Services, where they take the public's health into concern, because it's just not something that a lot of people even want to have a discussion about. And that's the other part of it that these people that have introduced this bill are exploiting. They know that people don't want to have these discussions about this stuff. And in this section here applies to the insurer. And I kind of highlighted it here that, and every one of these sections pretty much says the same thing. The wording and the terminology, everything is just kind of repeated consistently for each section, and the responsibilities of each, member of society even. And they even develop the it's based on and considering the standards of care published by the World Professional Association for Transgender Health. An insurer shall make a reasonable effort to ensure that the benefits required by subsection 1 are made available to an insured through a provider of health care who participates in the network plan of the insurer. So again, that section there is to enact the insurer to make the reasonable efforts. Okay, and then we go further in section 4. In section 4, a carrier must consider the most recent standards of care published by the World Professional Association of Transgender Health. That a carrier shall make a reasonable effort to ensure that the benefits required by subsection 1 are made available to an insured through a provider of health care who participates in the network plan of the carrier. So this is the carrier section. Okay. And we get to section 5. This is a section for society. When determining whether treatment is medically necessary for the purposes of this section, a society must consider the most recent standards of care published by the World Professional Association for Transgender Health. And a society shall make a reasonable effort to ensure that the benefits required by subsection 1 are made available to an insured through a provider of health care who participates in the network plan of the society. No. A society must not consider the most recent standards of care published by the World Professional Association for Transgender Health or anything published by any world association. Enough is enough of having this global influence infiltrating our freaking country and tearing us and dividing us and shredding us up into all kinds of little pieces, which are conveniently more manageable by our governmental agencies, huh? How convenient that the global agents created these guidebooks for our so-called leaders and people in charge of these systems to introduce this stuff to us and just make our life so much better with their standards of care. This section here is for a corporation, a medical services corporation, a hospital. When determining whether treatment is medically necessary for the purposes of this section, a hospital or medical services corporation must consider the most recent standards of care published by the World Professional Association for Transgender Health or its successor organization. A hospital or medical services or corporation shall make a reasonable effort to ensure that the benefits required by subsection 1 are made available to an insured through a provider of health care who participates in the network plan of the hospital or medical services corporation. Each section is pretty much the same thing where it talks about the different terms and the terminology and how to determine what's medically necessary. All that language is pretty much consistent throughout. It doesn't really change depending on which section you're talking about. Here's section 8 for a health maintenance organization. When determining whether treatment is medically necessary for the purposes of this section, a health maintenance organization must consider the most recent standards of care prescribed by the World Professional Association for Transgender Health or its successor organization. A health maintenance organization shall make a reasonable effort to ensure that the benefits required by subsection 1 are made available to an enrollee through a provider of health care who participates in the network plan of the health maintenance organization. So they were very specific. They got all of these different sections where they included all of this very specific terminology in some instances for each section and each person's and each member of society's responsibilities to make a reasonable effort to make sure that these people get the care that they need, right? Because they make the decision to do this to themselves. We as a society need to take responsibility for their medical condition, right? I don't think so. It really needs to stop, this global influence. And again, you're talking about the same terminology, the same wording. When determining whether treatment is medically necessary for the purposes of this section, a managed care organization must consider the most recent standards of care prescribed by the World Professional Association for Transgender Health. A managed care organization shall make a reasonable effort to ensure that the benefits required by subsection 1 are made available to an insured through a provider of health care who participates in the network plan of a managed care organization. So again, they offer up these standards and these guidelines which allow these so-called managed care organizations to bill insurance companies and get paid thousands upon thousands of dollars. There is a lot of money being promised to a lot of people, and we all know money talks and bullshit walks. And that, folks, is the harsh reality. That this bill and all the money that goes along with it, including new careers and new positions and new jobs being created to accommodate to make this enactment, are going to be on the taxpayers' dime. So guess what comes next? Your property taxes are going up, folks. They don't have income tax here in Nevada. But guess what's coming, folks? Guess what's coming? Because they're going to need your money to pay for these Medicaid recipients and these people that want this gender-affirming care, or rather, that need this gender-affirming care, right? And again, same terminology, same wording. When determining whether treatment is medically necessary for the purposes of the section, the department must consider the most recent standards of care published by the World Professional Association for Transgender Health or its successor organization. Now, you notice they don't use a whole lot of those acronymal things, like they didn't turn that into the WPATH. No, you have to say it's World Professional Association for Transgender Health. If a person appeals the denial of a payment or coverage under this section on the grounds that the treatment requested by the person is not medically necessary, the division must consult with a provider of healthcare who has experience in prescribing or delivering gender-affirming treatment concerning the medical necessity of the treatment requested by the person when considering the appeal. Yeah, so again, you're talking about doors that open up that allow the bad actors to go in and see dollar signs. They see money. So if they need a medical professional, someone, let's say, with gender affirming credentials, to give somebody affirmation to go ahead and have insurance cover this treatment, that would be worth a little bit of money to someone, wouldn't it? I'm just saying. Taxpayers should not be paying for it under no circumstances. Should taxpayers be paying for anything associated with gender-affirming care? That even includes getting someone mental health help for it. No, it should not be something that should be paid for by the taxpayers. And as far as parents choosing that for their children, again, if you stand for parental rights, because I'm repetitive, I have to say it again. If you stand for parental rights, then you stand for parental rights across the board, no matter what a parent decides to choose for their child, even if it spins your moral compass in a tizzy. If you stand for parental rights and you stand for personal rights and freedoms, then you have to stand across the board with it. Otherwise, you're a hypocrite. And as far as taxpayers paying for this stuff and requiring health insurance agencies to cover it, I mean, come on. Tell me that does not open up the floodgate. Seriously. And what is that going to do to insurance rates? How is that going to help our so-called broken healthcare system when you are requiring insurance agencies to cover this type of stuff here, when you've got people waiting in line to get actual life-saving procedures done, procedures and things that actually save lives, instead of just affirming someone's identity that they are confessing to the public? There are insurance agencies denying people coverage, denying payment for medically necessary life-saving procedures and operations. And you're going to push this through here in Nevada? Don't tell me there's not a global influence. The standards of care published by the World Professional Association for Transgender Health. Look it up, folks. I'm willing to bet that your county that you live in and your state that you live in also had somebody introduce this as well. And if they didn't, then it's because you have people on your board and people in your county in charge of the situation that decided to reject it, which is what every agency and every health department in this country should do with anything that has the word world or global association in it. Period. It's meant to divide and conquer us, and trust me, it is working. It is working. That's it on that one. I still want to go into more on the cloud seeding with the DRI, with the Desert Research Institute. So that's going to probably be the next one that I'll hopefully will get uploaded today. I'll try to get this one uploaded, talking about this particular topic here of gender dysphoria and gender incongruence, where the state of Nevada has required insurance companies to pay for it, including for Medicaid. So if you live here in Nevada and you have a problem with it, well, you know, I suppose you could probably write these senators and you could probably voice your opinion about it. But it's pretty much a done deal. You know what I mean? Then they're either brainwashed here by this globalist agenda and by these global standards and these global guidebooks, and they're completely ignorant to it, or they're in on it. And I'm guessing that most of these actors here are in on it, because there's a lot of overactors, if you know what I mean. So, thanks for watching. Please stay tuned. There's definitely more to come, if I can help it.